A team of Egyptian and Ugandan doctors have conducted surgery implant aimed at providing a platform that can transform the lives of patients with hearing impairments. A cochlear implant is an electronic device surgically placed under the scalp with an electrode inserted in the inner ear.
A team of Ugandan and Egyptian medical specialists have carried out an operation to restore hearing loss among children. The surgical procedure took some time with an insertion made on the skin behind the ear for special cochlear device. A cochlear implant is an electronic device surgically placed under the scalp with an electrode inserted in the inner ear. The cochlear implant function is to bypass the damaged hearing organ by electrically stimulating the auditory nerve. The device enables someone to interpret sound ranging from speech, among others. The cochlea forms the inner ear, which transmits sound waves through cells that are transmitted to the brains, among others. The implanted cochlear device replaces the part of the damaged inner ear. It receives sound signals and sends them to the nerves, keeping the non-functioning parts in the ear. The Egyptian medics noted that they wanted to extend their expertise and knowledge to the Ugandan population.
As we know, the cochlear implant is the only known device to restore hearing among deaf people where the normal hearing aids are not functioning anymore. It's not a surgery and finish, it is a program. It starts by surgery to be followed by auditory rehabilitation and then phoniatric rehabilitation. It's now not the deaf child or the deaf person is not considered a crippled or a handicapped child with the use of cochlear implant. He can be enrolled in the normal schools and everything.
Hearing loss is the second commonest disability in the human race. Very many children are born without hearing, or people who lose their hearing in adulthood. Now the hearing loss can be mild or moderate, or sometimes they're actually deaf. In the past, people who had no hearing completely were sent to School of the Deaf to learn how to communicate with sign language. But with cochlear implant surgery, we can actually make these people hear and be able to talk normally. Okay. Cochlear implant surgery is a complex operation, and in the past, people had to travel abroad in order to be able to access these services. But I'm happy over the last 3 years, we have started doing these operations within the country with the help of MEDEL and IHK. IHK has offered a center of excellence where these very delicate and complicated operations can be done.
Medics advise hospitals to start early screening in children, especially after birth, to revert the hearing loss problem.
It's important to know from the start because there's a small window for children up to 5 years. If they are deaf from birth until 5 years, and if you pass that, the progress will not be the same, or it might not be very good. So, but if you catch them in the first 5 years, then they can go to streamline schools, everything will be normal, their pronunciation will be normal, hearing will be very normal. Okay.
Their ears are tested to find out whether they have a hearing problem or not. As I mentioned, it's a very common disability in the human race. In Uganda, we have not been doing routine testing of children at birth. However, the Department of ENT in Makerere, the one in Gulu, the one in Mbale, and the one in Mbarara, in the month of June conducted a survey across the regional referral hospitals, screening of children who are born at their first immunization. So when the children come in for immunization, they are all screened for hearing loss. And we are in the process of compiling the data so that we have some documentation that we can now take to the policymakers in the ministry to be able to convince them that this is something that we can introduce at all public hospitals across the country. And that would be able to help us to catch children who have got a hearing impairment much earlier.
At least 4 to 11% of Ugandans suffer from hearing loss, while 1 out of every 1,000 children are born deaf. Most causes of hearing loss are ear infections, advanced age, foreign bodies in the ear, and loud noise. Many Ugandans are in need of treatment, surgery, drugs and hearing aids to restore their hearing, yet the procedure is very expensive.